Welcome to Migraine Insiders, brought to you by U.S. Pain Centers. My name is Kim Beals, and with us today on Migraine Insiders is Catherine Charrett-Dykes. Kat lives with her family on Long Island. She is president and founder of Chronic Migraine Awareness. Hi, Kat. Thanks for joining us.
Hi, Kim. Thanks for having me. I'm so happy that I could be here.
Well, great. We're happy to have you. So, to get started, I like to ask my guests some quick questions, what I like to call migraine icebreakers. Are you ready?
I'm ready.
Do you suffer from migraines?
Yes, I've been suffering since I was 13 years old. I just turned 46. So there's more years suffering than there have been without.
Yeah, wow. So obviously you probably have some triggers. What's your number one trigger?
The weather is a big trigger. The storm that we have coming right now, I'm already feeling it. It could be sometimes it presents in different ways, but a lot of the time the barometric pressure is, I could feel a change. I could tell you exactly what moment it drops.
Right, right. Wow, a lot of people. The weather seems to be a big one, and they don't even really think about the weather as being one of those triggers, you know, but that seems to be a common theme we're finding. So how long was your worst migraine?
Well, it's hard to say how long, because when you're chronic, it's one on top of another on top of another. But this time last year, my pain was so bad that I was planning my own death because I just couldn't see another way out. You know, they tell myself all of the reasons why I should stay, but it got to the point where none of those reasons were almost good enough. But luckily, I had one more doctor to go see. And I said, you know, let me just see what happens with this one. And luckily, he has been able to lower my pain. And this time last year, I couldn't even hold a conversation. So this is a huge, you know, before and after from where I was this time last year, crying in a fetal position to smiling and being able to look out a window. It's so that would have to be my worst one.
Yeah, I mean, you look great.
Thank you.
Well, we're glad you're here.
It took a lot of work.
So I would imagine, suffering from chronic migraine, that you probably have missed some things in your life, Thanksgivings, weddings, I don't know. Tell me about, you know, what have you missed?
I've missed so many things. Mostly it's the everyday stuff that just not being able to be a mom and a wife. Just, you know, I'm like most people that wanted to be the stay-at-home mom. I couldn't wait to have kids, couldn't wait to do that. And for a good, 4 years, I was just in my cave, as we call it, which was really the laundry room. It's the darkest room. There's no windows. There's only one door. And it's, the quietest room in the house. And it's, you miss those things where the kids just can't do things after school because I couldn't drive them, can't have play dates with they can't have friends over because mom's not feeling good. It really affects the family so much more than people realize. And of course, then there's the extended family. I'm one of 6, so we would get together and do family at least once a year, have some kind of either go on vacation together or have at least a barbecue. And when we get together, just the small amount of us, it's at least 30 of us. So it got to the point where we had Thanksgiving here, just one of my brothers, and I ended up having to leave. I had to leave my dinner and go downstairs to the cave, and just, I couldn't take it anymore. And that was probably the last Thanksgiving we had here, where since we had been married, it was always our tradition to have them over. Yeah. So it's hard to have to give up those things. You actually mourn part of your life that you feel like you're never going to get back.
You have an emergency migraine kit, I'm sure. What's in your emergency migraine kit?
Well, for me, there's really not much in it other than lots of ice packs and water. There's not many places I get to go out, but if I do, then I'll usually bring one of those ice packs that you can snap so you can keep cold in case of an emergency. Overheating for me is one of those things that could trigger. And my medications, and right now it's mostly just the pain medications because the normal run-of-the-mill treatments have just not done anything for me.
Right, right. Well, we're going to get a little bit more into now. Your members call you Cat. Is that what you go by, Cat?
Yeah.
Call you Cat, or you want me to call you?
Cat is fine. Yeah. Okay. I grew up. All of my brothers and sisters call me Catherine. In high school I was Kathy. I've been called many things, and Cat just, with that long last name now, it just seems like I have to add something short.
Yeah, that's true. Okay, so if I could, I'm going to call you Cat.
Absolutely.
And that works for me too. So now we know a little bit more about you. Let's talk about chronic migraine awareness. So what is chronic migraine awareness? I'll let you tell.
Well, it started out as just a small chat group on Facebook. Now we are officially a nonprofit organization, and we're still waiting on our tax exempt, where that letter should be coming any day. So I'm very proud of the fact that we were able to bring something that was in the, not to say the fake world, but in the digital world into the real world. Like I said, it started out with just, since I had to quit my job, I used to train and teach martial arts, but it got to the point where that was just not possible. So I had no way to have any kind of social life or any kind of contact. So I went kicking and screaming onto Facebook, where I was like, I don't really want any part of this. And I've eaten my words many times since then. I ended up starting a small group where people were in a regular migraine chat group for occasional or episodic migraines, and realizing that they were just as badly off as I was. So, we started maybe 15, 20 people. That group, we just celebrated over 2,500 people in just that one group.
Oh my goodness.
Now we have over 30 groups for, different types. We have the general main group, and that is, everybody. And then we have other subgroups for the UK, Canada, Australia. We also have groups for caregivers, those who are feel that they're suicidal. They're people who just have severe depression, but not necessarily suicidal. And especially with those topics, there's a lot of taboo around them. People don't want to hear, oh, don't talk like that. We don't want to hear you that. But the people who are suffering it, they need to talk about it. They need to let people understand how bad it really is. And for people to say, we don't want to hear that, although it sounds like they're being supportive, it's really just denying a part of who the person is. And that's, when you need it the most, you can't have somebody tell you, I don't want to hear it.
Right.
So,
just an interesting thing about that is also, I would imagine, and I think people probably, anybody who goes through a serious illness where death might be in the picture, that you almost don't want to talk about that with people who are close to you, because you also don't want to scare them or make you, because they want to know you're being positive,
Exactly.
So, you don't want to talk to them about it. And I imagine that a group like Chronic Migraine Awareness, or all of those other branches of your group, which I wasn't even aware, you're worldwide now.
Yeah.
I mean, that's someplace where you can say those things, and the person you're saying to them understands. They're not going to tell you, oh no, I don't want to hear that.
Exactly.
You said, and you don't have that oh, I've got to be strong and I can't let everybody know how really bad I feel about this.
Yeah, it's hard to be strong every day. It's, even Superman had his bad days. He has his kryptonite. So, that's part of it too, where so much of what we're doing is trying to fight and hold on to that old life. And there's just some things you have to get to a point where there's things you can do and there's things you can't do, and if you try and do them, you're just going to pay for it. So there's a lot of trade-offs that you have to make too. So it gives people a place to be able to talk about them, and also on Facebook, it's a private group, so it doesn't show up on their newsfeed. So that means that unless you're a member, it can't be seen by anybody else. So they're free to speak as freely, as openly as they want, even about family members, which a lot of the time you would expect that they would be our biggest supporters, but they're sometimes the worst ones because they think we're overreacting, we're lazy, it's just a headache. And, until we can get those people around us to understand, it's impossible to get, strangers to understand. If your only family isn't going to be there for you, then who is? So with this, we sort of have created our own family and people who do understand and say, I do believe you, and having that validation has been a lifesaver to many people, and myself included.
Right, right. Well, so, I was going to ask you, how does the group really help people, which we've kind of, members, and we've kind of just touched on that a little bit, but, but there's a lot of things beyond just even the chat that you've been doing.
Oh, yeah.
That you do to kind of support members and when they do have those dark days and not to, the just having that outlet to be able to chat with somebody or to bounce something off somebody, a treatment, new treatment, or how you're feeling. But how else does the group help migraineurs?
Well, we also have a research team that is constantly looking up and listening to finding new information about treatments that are out there, recalls on medications, anything that would be interesting to a migrainer. A lot of the stuff that's out there is junk. So unless you know how to look for it, you don't know what the stuff is that's good and what the stuff is that's bad. So we try to give an unbiased opinion on these are the different things that are out there. Some of these things are going to work for you. Some of these things are not going to work. But it's one of these things, it's a lot of trial and error, and just making sure that they have the information. Because a lot of these doctors are unaware of the diagnosis even. It's really only been an official diagnosis since like 2003. So your typical doctor is not caught up on all of this, the new changes in diagnoses, and then even if you have the diagnosis, it doesn't necessarily mean they know how to treat it. So if you are an educated patient and you come in and say, I've done my research, these are the things that I know about, you can work with your doctor and become a partner in your care rather than just going to them and hoping that you're going to get the best care. Because 100 people can graduate in a doctor's class, 50 of them are at the bottom.
That's scary thought.
It is a very scary thought, and they're still a doctor, and we have in a country where we believe that the doctors know all the answers, and that's not always true. So you have to be an advocate in your own health. You have to stand up for when something is not right. You are allowed to say, you're fired. I'm going to find another doctor. I'm going to find somebody who listens to me and is not just going to, give me some kind of Band-Aid and patch me up and send me on my way just so they can make their co-pays. And, there's much more to it. It all goes back to having that validation and, saying, yes, you are sick. You have a real reason to be upset about not getting the proper care. So part of what we do is also advocacy, and then spreading awareness to others, along with one of our projects and subgroups is called the Bomb Squad. And what we do is somebody who is in our group is having a particularly hard time. With their permission, we get their address, and they become a target. And people that have signed up, volunteers, will just post cards, and it will be supportive. They'll also go on their Facebook wall or Twitter or whatever accounts they have and just, again, be supportive. And hopefully it's twofold in that the person who's receiving it gets that feeling of validation and being not alone, but also, too, it's hopefully will open up a conversation where people around them will see, why do you have all these people sending you cards? What are all these posts on your wall about? And they say, well, it's about my chronic migraines. It really is something, and these people are here to support me. So hopefully that helps to spread awareness, and they go, oh, I didn't realize that that was a real problem. And, from there, hopefully, things will get better for us.
Right. Well, speaking of awareness, I see you're wearing the chronic migraine awareness ribbon.
Yes.
And you kind of had a hand in putting that together, didn't you?
Yes, actually, back when I was still before chronic migraine awareness became what it is, it was the ribbon. I just thought it was something that we needed again because chronic migraine became its own diagnosis, but it's not just a headache and it's not just a migraine. To be chronic, you have to have 15 migraines or more a month, and they last a minimum of 4 hours. 4 hours rather or more.
Right.
So if you figure that over a month period, that's, if you're lucky enough just to have 15, which sounds ridiculous to even say, that is still half your month that's gone. And even when you have the migraine and if you're lucky and it passes, it doesn't end there because then you have what we call the migraine hangover. It feels like a hangover, but without any of the fun. You're listless, you're lethargic, your eyes are sensitive to light, your head is still killing you. Sometimes you eat, you can't eat. It wreaks havoc on your whole body. So it's not something that just affects your head. It affects every system. You can have a skin sensitivity where, women will understand this. You have to get the ponytail headache where you have your hair up and then you move your hair and you're like, oh, my hair hurts. That's something called allodynia, and very common just to have that. And, it just it lights your hair up, lights your scalp up. And then, with also that, there's also comorbid conditions like fibromyalgia and depression. And, it goes on and on and on and on. It just, like I said, it's just the tip of an iceberg, really, for so many other things that are going on and people just are not aware about it.
Right. Right. So was there something that really one particular thing or anything that was your motivation or inspiration in starting CMA or keeping it going, or what drives you?
My daughter. In 2009 was the year that I had to quit teaching at the dojo. It also happened to be the same year that she got her first migraine. I had a chance to, as part of my treatment, to become a part of a clinical trial. And I was, again, hemming and hawing. Did I want to do this? And do I want to be a guinea pig? And then she had her first migraine, and I realized at that moment that it was no longer just about me. It was about her. That, this thing that has, followed me my whole life is now going to follow her. She was only 12 at the time. And, since I've been doing this, you find out that migraines have been linked to colic. And you go, colic is infancy. And then you think about all the shaken babies, and there's the lives, having to go through pain from that part of your life and being misunderstood and not getting the right help and being blamed for your condition or things like that. No child should have to live with that. This is 2014. Right. This has been going on since recorded history, that migraines have been, or head pain has been an issue, and we're no closer to finding any solution for it. At some point, somebody has to draw a line in the sand and say, this is it here and no further. So if I have my way, migraines will go the way of polio.
Wow.
I don't know if it will be a vaccine, but I would like it to be a point where, our kids or grandkids will say, oh, yeah, migraines, yeah, I know somebody who used to have them. I'm glad I don't have to worry about it. It would be a thing of the past. But it's going to take a lot of work to make that happen, since most people aren't even aware of it yet.
Right. And that's part of, getting the migraine community together to speak as a voice. you know, and draw attention with the ribbons, with the activism and the advocacy, and just getting it out there, and letting people know that it's not all, as you said, not all in your head. You know,
Mhm.
it's not a take two aspirin and then it's going to get better type of thing. Recently,
Exactly.
you know, talking about daughters, my daughter just a couple months ago had her first migraine, and it actually landed her first one landed her in the hospital.
Mhm.
It was so bad, the emergency room, and then, you know, in the hospital. And it was kind of interesting because the neurologist that came in really was like, well, you know, you can't say that that's a migraine. You know, that, you know, you have to have a history, you have to have had more than one, you know. And, you know, I didn't say anything about,
Mhm.
you know, knowing a little bit more about migraines than maybe he thought I probably did.
Mhm.
But you know, because I was concerned about my daughter, and I want to hear what they have to say. And so it's a serious thing. And then when it starts to include, you know, your children, and it is can be somewhat hereditary, and
80% chance of somebody in your family having it if you have a migraine sufferer. 80% chance. Lottery is not that good of a chance.
I wish it was. Um,
Exactly.
so, yeah, that's true. So looking at CMA, what is the hardest part of managing an online community like that with people who are suffering from an illness, and you know, sometimes they're going to be in pain, they're going to be cranky. We're not all in the best mood. Matter of fact, when we want to talk about that stuff, we're probably not in the best mood.
Mhm.
So tell me a little bit about how you Do you manage it? Do you have you know, other people who help you out?
Oh, yeah, absolutely. It started out with just me, and then I picked up people as I've gone along, and people who are just as dedicated to finding out and helping others too. We have one of the people that are in our group. Her name is Kate. She has a group for parents of children who suffer, and also she has a daughter that suffers as well. She's had to be homeschooled. She's missed her high school years. Everybody else is looking towards proms and things like that. That's just not an option for her. She's just going to miss those things. I mean, I have myself with there's about 15 of us that are part of the nonprofit, and executive directors and group directors, and that's another great thing about CMA too, is that it is able to have people that are members be participants in the community as well. We work on migraine time, which means we're all suffering. So we work when we can, and if it's 10 minutes or it's 10 hours, whatever it is, we're happy to have that time, because like you said, maybe we need a break, but somebody still needs an ear or an eye, so someone else can pick up where the other one drops off, or takes a step back, or is doing some other kind of project. We have different ways for people to people want to be a part of society. They want to feel needed and wanted, and the hardest thing to do is when you're from your sick bed. So we do everything from our sick bed. There's days where we can't speak, but if we're able to type a few lines or send a text, or if we make somebody smile that day, then it feels like at least it was worth it somehow.
Mm-hmm. Well, so for you personally, you're suffering, you know, you suffer. You have days, I'm sure, that you know, you can't do everything you want to do. And so then do you sometimes become the member?
Oh, absolutely. I've been bombed by my own bomb squad, that I actually have photographs, not photographs, rather, picture frames of cards that people have sent me, and I look at them. So those days that I have rough days, and there's a lot of things to deal with a nonprofit, even if you're not sick.
Right.
So it's a headache to begin with. So imagine trying to do it while you're sick. It's even more of a headache, no pun intended, or pun intended.
where would somebody reach out to join the group? Would that be would they search for chronic migraine awareness on Facebook or?
Yeah, our support groups are all on Facebook, but we are on all of the social media sites. But if you wanted to join the group and you wanted to have personal interaction, then if you go to Facebook and type in chronic migraine awareness, it will come up with, like I said, all of the groups that we have. Some of them are task groups, which means like it's a place where you can volunteer. And some of them are just groups where there's support. They said we have support for, just for men, for moms who are moms to be, moms that are experienced already, have been through that road already. Caregivers, those, especially the ones who are taking care of us, get just as fed up as we do because they're sick of seeing us sick all the time. They want their husbands and wives back. Right. That this is, not what they signed up for, kind of thing. And that's another thing too. It's, it's very tough in marriages and families. So there's a lot of people who, have a lot to offer still. Just because they're sick doesn't mean that they're not useful. And like I said, it gives away having the support groups gives them a way to be useful to others and to still get relief for themselves.
Right. Right. So now maybe you could give us a little bit more information about your personal migraine journey, just what you feel comfortable sharing.
It's a long story.
Yeah, but I mean, it's like you said, it's important for other people who are suffering from chronic migraine to know that they're not alone, and they can make it through. They can make it through and find a way to manage it, and I mean, and we don't want anybody to get to the point where, like you said, you were last year, and I know sometimes, we hear members are feeling like, there's just no reason to keep going on. It's so much pain. But so tell me, what's your journey been like?
Well, my first migraine, I was sort of laughing to myself in a way that, when your daughter had a migraine, you brought her to the hospital. When I had my first migraine, I was about 13, and I was blind peripherally. So it was as if I had blinders on my eyes, and I just couldn't see anything on the side. My left hand was numb, and it felt like a knife was, being stabbed in the head. Mm. And I came home, and I told my dad, and he said, take an aspirin and lay down on the couch. So I took an aspirin and laid down on the couch, threw up a little while later, and then the next day I didn't feel so bad. So, that was how typically, healthcare was in my house. And if you weren't coughing up a lung or bleeding from some orifice, you must have been okay. We didn't go to the doctor for every little cut and scrape, where now we bring our kids for checkups all the time, and everybody knows we bring them to the pediatrician. So, I grew up in a different I don't want to say time period, but a different way that we look at healthcare than we do now. So I think a lot of it too is that, from that point on, I just accepted that, this must be something everybody gets. So this is normal. So I accepted that as normal until I had my son in 1995. I knew that there was something not right, but I didn't know what was wrong. To go to the doctor and say, my head hurts, because my head always hurt. It just is something I got used to. My vision was blurry while I wore glasses, so it was hard to say that was it either. So I went to him and I, tried to explain it to him, and his diagnosis was, maybe your ponytail is too tight. So I knew that it was not my ponytail, and I managed not to throttle him. Mm-hmm. So, I went to another doctor, and this time I went to a neurologist, and he said, you have epilepsy. So he was going to put me on anti-seizure medications and stuff like this. And I said, well, this is serious business, epilepsy. I need to get a second opinion before I start, getting involved in that. So I got a second opinion or a third opinion, and he said, it's anxiety. You're hyperventilating. This is it. This and that. So I got a fourth opinion, and the fourth opinion. This went on and on. And it got to the point where I was just so sick of going to the doctor because they didn't have any answers. So it just kept getting worse and worse until 2003, when finally I was just like, I don't know what's wrong. You know, my vision is blurry. I'm sensitive to light, and my sensei said, "Oh, you sound like you're having a migraine," but it was not like the migraine that I had back when I was 12 or 13 years old. It was different. So I didn't know that there could be different types of migraines. There's not just one set. So when that doctor said to you, "Oh, you have to have a history," or "You have to have this," it's like, you know, it presents in so many different ways that, you know, again, that's the ignorance in the medical community is as bad as, you know, our own ignorance as to what possibly could be wrong with us.
Mm-hmm.
So, you know, by 2003, I started, you know, the typical pain, you know, the regimen of, you know, try this drug, come back in a month. Try this drug, come back in a month. And it was one failed drug after another after another. And then, like I said, in 2009, when it got to the point where I just was not able to function anymore outside the home and barely inside the home, I decided to join the clinical trial. So I did go for it, and you know, as part of the study, I knew that there were going to be a chance for complications, and I ended up having to have 4 surgeries for it. And I only got some minimal relief, but it gave me some hope that things could be better. I've tried since then to add a frontal one, but that didn't really work out right. But I'm still hopeful that it's something that has helped people, and with more studies and more understanding of it, it could be a solution. Now I've been going through, still taking, you know, other medications, pain medications. I have been getting IV infusions of DHE, magnesium sulfate, Benadryl, Reglan, and a couple of other things they toss in there too. And that has helped bring my pain level down to a level where, you know, like I said, it's not that I didn't want to live, I just didn't want to be in pain. So being at a level where I can, you know, do something like this, where this time last year it was impossible because speaking was a trigger. It was just, you know, it just was unbearable. So it's been a long, hard road, but, you know, with perseverance and, you know, firing doctors if you have to, you know, finding people who know what they're talking about, it makes a difference.
Right. I think a lot of people that suffer from any kind of illness don't realize that they can go beyond their local community to
Mm-hmm.
find the answers. You know, and it really it's necessary.
It absolutely is.
You know.
The local doctors, you know, they're general practitioners. They know a little bit of everything. It doesn't mean they're specialists on this one thing. And even if you go to a neurologist does not mean you're a headache specialist. You know, I know I've been doing this for at least 5 years, and, you know, I'm only beginning to scratch the surface of things there is to know. I can't believe that a doctor should know everything in a few hours like that, too. It's just, you know, like I said, it's such a new diagnosis that, you know, I don't know that they're even taking into consideration that the drugs that they're giving us are not medication that were designed to treat migraines. They are hand-me-down drugs from people who had seizures and had migraines, people who had high blood pressure and had migraines, or, you know, some other such, you know, treatment, asthma, that, you know, they were lucky that they had a reduction in migraines, but it's still, you know, for somebody who doesn't have seizures, and then you start taking an anti-seizure med, that's it. You have to take that medicine every single day, and if you don't, you have a seizure.
Right. Right.
You know, and then there's all the side effects that, well, you know what? I think I'll take a chance on this because this is better than what I'm going through. You know, that's how bad it gets. You know.
Is there anything else that that you feel like you want people who maybe don't suffer from migraines to know about people who do suffer from migraines?
I think that there are different levels. You know, you have a person who can have an occasional migraine. Maybe they'll get one a year or two a year. And then you have somebody who's episodic who could get it monthly. It could be hormone related. And then you could have somebody who's chronic. It's something that just because you've had one does not mean you know everything about it. You've had a small stamp-sized window into our world. It's something that once you become chronic, it's not even, you could say it's a death sentence, because at least if you had a death sentence, you would know when it was going to end. With this, it's just constant, every day, every day, every day, and there is no known end to it. And you go to the emergency room, you go to a doctor, and they're like, well, sorry, it's a migraine, you're going to have to live with it. And I just can't see how that could be acceptable. And then again, when you go back to the fact that, okay, I'm an adult now and I'm chronic, but for the kids who are chronic and they haven't even had a chance to live their life, that is just, it's unfair. And then, like I said, then you go back to the infants. Infants, it's just, it's horrible suffering for them. If you think about, how a baby with colic, all they can do is scream and, tighten up all their body, they scrunching up, and that's all they can do to get relief. I mean, most adults feel like that too, but we're not allowed to act that way. But, if we could get it before it gets so bad, we wouldn't have to have all these chronic people, I think also too, it's very important for people, once they get that chronic diagnosis, to find a good therapist. Find somebody who is going to listen to you, and they will validate you when you go and talk to a pain doctor, because you need to have those three people. It's got to work as a team. There's so much going on in your body that it's not just one thing. It's your mind, it's the pain, and then whatever neurological issues you have going on too. You need to have those resources in place and have them talk to each other.
And you need to join a group, an online support group like Chronic Migraine Awareness, or all the little branches, and again, the fact that there's I guess there's a public type, there's a public part of it, and then there's the private part where you can be totally private with and discuss with other migraineurs bluntly, right? And openly about the way you feel about your and just get it out. And because sometimes you can't leave your house, you can't go to that therapist, you can't get out there. Obviously, the members of your group aren't dispensing medical advice, but nobody knows better than somebody who's been there. And
It just, even those people have, they have had experience taking certain medications. There's one medication that we call Dopamax. It's not its real name, but one of the huge side effects is that you lose your memory, and it makes you stupid. Some people who use it, it's been a godsend. So it's not, one of those things you're not going to know until you try, but at least if you've seen people that said, okay, these are the symptoms, yes, I've had this is typical for this, they are not so afraid. And then there's, there is that emotional and private side where people want to talk about their sex lives and how it affects intimacy. And, when you're in pain all the time, the last thing you want to do is be touched. And that, again, affects, relationships greatly. You don't want to discuss that on the public page, but people will bring it up privately, because in this place, we're all the same. It doesn't make a difference. Chronic migraines don't discriminate on whether you're gay or straight or black or white or anything, or how much money you make. It doesn't care how old you are. So we have a level playing field right there. So, and I think that, of course I am prejudiced to say that, the people that I've met that are chronic migraine sufferers have a level of empathy for others that just makes them wonderful souls, to be suffering as much as they are and still want to be able to, help somebody else out while they're suffering is an incredible thing.
Right. And you are a testimony to that.
Thank you. I try.
Yeah. I just, it's been a pleasure to speak with you today and to have you on Migraine Insiders. I'm so glad that you're here and you're getting, the management seems to be going well right now for you, and that's a great. You look wonderful.
Thank
So,
you.
and I hope you'll come back and tell us some more about chronic migraine awareness, the group, and how you're doing. Keep us posted on how things are going.
I would love to.
If you have anything special coming up, or any event you need to get, I mean, you have quite the group, so you probably have plenty of ways to get the information out. But we'd love to be able to help you with that. So thanks again for being on the show.
Thank you. And just one of those things we have coming up, June is June is Migraine Awareness Month, and June 29th is CMA Day, Chronic Migraine Awareness Day. So we'll be doing something, hopefully, locally within our chapters, or something globally so people can see and, try to help make this invisible illness a little bit more visible.
That's great. That's great. CMA is a great service to the migraine community.
Thank you. I'm really proud of him.
To learn more about today's guest, Kat Charrett-Dykes, or her group, Chronic Migraine Awareness, you can visit usPainCenters.com and click on Migraine Insiders. Thank you for joining us. My name is Kim Beals, and this is Migraine Insiders, brought to you by US Pain Centers. You can find them online at usPainCenters.com.